Hello, everyone. It's Revitalize MD, and I have the Revitalize MD team here today, and we're going to talk about Lutronic Ultra, our new laser that does a great resurfacing, and it also does a hair treatment. And so I'm going to let them introduce themselves. I'm Bella.
Hi, I'm Bella. I've been with Dr. Durst for about 2 years since she opened up the new practice, and I'm up front. I'm a patient coordinator, and if you have any skincare questions, you can always ask me or any of the other estheticians as well.
Hi, I'm Meredith, and I have been with Dr. Durst for almost a year now. So I mainly focus on skincare, so skincare specialist and laser technician as well.
Hello, my name is Marissa. I've been working with Dr. Durst for almost 2 years now. Known her for about 13, and I'm one of the medical estheticians. And here we are.
Yeah. Well, and we're going to talk about Lutronic Ultra, which is our new laser. And so it was previously known as LaseMD. So even sometimes we get it confused. You know, we'll call it LaseMD, but it's actually Lutronic Ultra. And we even sometimes call it, yeah, we have all kinds of
names.
We do have lots of names for this laser. LuMD, Lulu, Lutronic MD. But anyhow, what it is, all of those names apply to a fractional non-ablative treatment. And so what that means, again, if we broke it down to the fractional part, we're going to actually end up, kind of making holes in the skin, fracturing the skin essentially, but without needles. And we're doing it with the laser. So micro injuries into the skin so that you stimulate collagen and elastin. And so we can do some things with that, put some products on after that are now going to get better absorbed or use PRP. And then the ablative, non-ablative part means when you ablate, you're taking a layer of skin off the surface. So if we're doing a chemical peel, for instance, we're going to take a layer of skin off the top. That's why you get all the peeling. Or there are ablative laser treatments as well. So this one, when you're talking about non-ablative, you don't have the downtime because you're not taking that top layer of skin off. And with the fractional part, we're actually creating micro injuries and so therefore stimulating repair and collagen elastin growth. And then you don't have the downtime that you normally would have. And this laser does a resurfacing, to anywhere, but mainly we're talking about head and neck and décolleté for women, of course. My big pet peeve is to not include that. And then hair treatments too. So we'll talk a little bit about that, and I'm going to open that up for discussion with the whole team. So if we want to talk about kind of the first steps, we're obviously making an hour appointment for everyone that comes in for this treatment, but a lot of that is related to, numbing medicine and getting them signed in.
So we topically numb, not necessarily that it's really a painful treatment, but just to make you comfortable. And so then we can actually go deeper and harder with it and get you better results. And that way you can just lay down and be comfortable without feeling any pain or any discomfort as well.
So you're going to leave them about 30 minutes, between 20 and 30 minutes to numb and to use that topical. Okay. And then again, just kind of getting you and answering any questions, getting you checked in, making sure consents are done. That's another, maybe 10 or 15 minutes. So then it comes down to the actual treatment, which really doesn't take too long.
Right. No, it's pretty quick. You want to talk about the treatment, Marissa, a little bit?
The treatment is very comfortable considering Meredith has done it without numbing cream.
Yes, we talked about that earlier. The fact that I did it, I think, on around a 12 without having any numbing. I think I numbed for maybe 5 minutes. So with the numbing cream, it is very comfortable. You can kind of just relax.
I had numbing cream on about 15 minutes, and I had it on a lower setting, and I told him to turn it up. So it's not bad.
Right.
We've done 2 other treatments that might be a little bit more uncomfortable. But the treatment works very nicely. You're going to get a little erythema, some mild swelling for about 24 hours. The results are amazing. For a few days, you will have 5 to 7 days, you'll have some, your skin will feel like sandpaper, but it will, hate to say that, but that's the texture that you'll feel. Visually, you really won't see that, but feeling of your skin, you'll feel that. But it just slowly sloughs off throughout the week. Usually there's no real peeling. It just slowly sloughs off.
Yeah, just kind of disintegrates. Most people, and you're really not supposed to, they say you're really not supposed to, even though you feel that texture, and it's automatic, especially when you're in the aesthetics industry, it's an automatic. You really just want to scrub it off because people hate having any texture on their face. We strive to have really soft, supple skin at all times. So when you feel that
let it be.
Yes, you just have to let it be. So, but if you still have that texture on your face after about 5 or 6 days, I definitely recommend going ahead and scrubbing. It's not an issue, but it's just part for the course of trying to that type of laser. If you don't have that layer of skin come off like you do with other non-ablative things, it is a different.
It's a different feel for sure.
Right,
but
if you're having some discomfort with that feeling of the rough texture over, sooner than 6 days, of course, just stay in contact with us. There's things we can do, but we've got to ask lots of questions to find out where you are in that situation and what we can do. Also, my favorite part about the Lutronics Ultra is how bright it makes your skin look. And that's pretty safe for all skin types so far. So I really, really like that.
And so the effects of this, again, you're getting a resurfacing. So anytime we're talking about resurfacing of any sort, and we have lots of different ways to resurface, you can do microneedling, you can do peels. We have other lasers that we can use, for that, Morpheus or even our Fotona has multiple depths. And again, you can get some ablative peels with that, with a little bit of downtime as well, or a lot of downtime, really depending on what your needs are. But you're going to get no downtime, a very comfortable procedure that's going to hit fine lines and wrinkles and pigment and texture, not in the short run, obviously, because we got a little texture, sandpaper just for a few days. But that's because it's healing from the inside out. And so then you also have, pigment. So pigment, pore size, fine lines and wrinkles. And again, you can get it around the eyes, crow's feet. It's a great treatment. And then even if somebody wants to add something on to like a hydrofacial, when they're getting those monthly treatments that are going to clean up their skin and get out the oil and all the dirt, you can also add on, this
another
too.
option too, before you do the Lutronics. That would be a great option to be dermaplaning, just to help kill off all the dead skin cells, any peach fuzz or anything that you typically have on your face for people that haven't done dermaplaning before. It's very quick. It's very effective. It's easier to get closer to the surface with a laser once all of that is gotten rid of. So the closer to the surface, the better, because again, we're trying to puncture those micro injuries into the skin and get underneath the surface so it penetrates outward. So anything that's blocking that is going to prevent you from getting as good of a treatment. A lot of people don't have a ton of peach fuzz or hair and things like that on their face either. So if that's not a concern, we don't need to worry about that. But a lot of people already get dermaplaning on a regular basis because they're addicted, which is great. So do your dermaplaning first, and then you can do the laser immediately follow that.
And so when you're actually talking about the procedure, again, they're little rollers. They almost look like little toilet paper on a little roller. And
without paper.
But without
right.
But no needles there. And so if you look at the procedure, we're going over all areas, and we can again, with a little bit of overlap, multiple passes, and we can alter the energy based on your comfort level. And then again, we can get more intensely involved if we need to around the eyes, around the mouth, if somebody has some areas of concern they want us to address. And again, I always recommend that you add on a neck and a chest to any treatment of the face. Again, these girls come out with redness to the chin, to the, and then I think they just need to go all the way, or else when they're my age, they will regret not having done so. So, again, a very comfortable procedure as we're starting to roll over. It glides pretty easily.
It's very easy to use, very, very smooth. And again, as far as the energy goes, we can adjust that to your comfort level. We've been going a little bit deeper, a little bit stronger on the cheek area, a little bit lighter, obviously, around the eyes and the forehead where we have thinner skin. And then, of course, with any type of laser, any procedure, really, you're really sensitive around the mouth because there are so many nerve endings there. So we typically will turn it down a little bit, but a lot of people have a lot of concerns around their mouth. So we do try to go as high as we can within the comfort zone of that area. But the forehead specifically, it's so thin, and under the eyes is so thin. We will turn it down a little bit, but you can go mid-treatment. Turn it down anytime you want, turn it back up if you feel like super comfortable. You can change it as you wish. So I really like that about this procedure too. You don't have to stop it, change hand pieces, turn it down, press start again, press stop. It's very easy to use and quick.
Smooth and quick. And then, again, you can add on those areas, even the hand, actually, you can add on to that area. It's another area of aging.
All the way down your arms, your forearms. And another thing to think about is that you want to know the difference between microneedling and Lutronics Ultra, excuse me.
See, there goes more names.
Here we go.
5 names.
Creating another name.
We're going to put out a poll to see what people want to call it. We're going to help you. You're going to help us name it. Yeah.
There we go. Lutronics Ultra. It creates microchannels to the dermis. However, microneedling also creates microchannels to the dermis. However, Lutronics does not create pinpoint bleeding. So that's kind of another good thing, that if someone was concerned, hey, I don't want to have blood on my face. Okay, there's no pinpoint bleeding, just erythema and some swelling and redness, of course.
And I think that you're just not using needles. You're right. You're not going to get any blood, and when you're not using needles, and then maybe there's a slight, price point difference, but not much, because I think that
it's very comparable price wise. Yeah. Right. Even, within package form or just individually. So,
and I think, again, if we come to that, like, we should always get packages of treatments, and because you're going to do them in a series, maybe come back to doing it once a year or so after you do a series, but still doing something every 4 to 6 weeks for your skin. And then there's some add-ons that you can do, either in the way of product or Lutronic specific product. Tranexamic acid is one of them, and that helps with pigment. We have vitamin A, which is more skin turnover and, again, photo aging and wrinkles, really. And then vitamin C, which will, again, help with pigment and photo aging and sun. And resveratrol, which is, an antioxidant that likewise helps with skin turnover and health.
Oh, sorry, go ahead. No, you're good. And we also recommend, we have several different companies that we do, but we also recommend sunscreen, just because I feel like it's kind of, you're going to spend so much money on any of our resurfacing treatments that we have, but just to spend that extra $30 to $60 on sunscreen and just applying it every day, you're going to protect your skin, because you don't want to invest in your skin and then not take care of it as simple as just putting a sunscreen on once or twice a day.
Right.
And we have so many different ones. So we have some with a little bit of pigment in it. So like today I used it kind of as a BB cream, and then we also have the completely clear ones. And so, because people think about sunscreen just in the summertime, but you really need to do it like all year round if you really do want to protect your skin.
Go away.
Yeah, it doesn't go away.
So it's almost as if you're doing a treatment and you're stopping at the jawline and not going on to the neck and the face. It's the same thing by not using a sunscreen on a daily basis. We spend money to get these procedures and have our skin looking great, but you need to have sunscreen on it at all times. When you're driving in the car, you're getting it. I've heard people, and when I'm doing an Uber ride, saying they're never outside. They don't need sunscreen.
Yeah.
Yet, they have exposure all day long. So you
Every
definitely
single day,
need that.
right.
Yeah.
There's no sense in working on pigmentation and then not protecting yourself when you go out.
Correct. So
Really,
Or using good skincare to start off with.
right.
Yeah.
Right. All of those things are very important.
Well, so I think that we've covered the Lutronic, for the Lutronic Ultra, the LaseMD, whatever we're going to name it. We'll put a poll out, and then we'll talk again in another segment on Lutronic scalp treatment, the Keralase treatment. So leave us any messages, any questions you might have, anything you want to cover or know, and anything that we may not have covered. And thank you so much for joining us today. This is Revitalize MD, and this is my wonderful team. And we'll see you next time.